Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on poisoning. Let's get started with question number 1. For the following case, which of the following sets of laboratory results is most likely to be found in this patient? A. pH 7.26. Arterial partial pressure of carbon dioxide 60. Bicarbonate 26. B. pH 7.37. Arterial partial pressure of carbon dioxide 18. Bicarbonate 10. C. pH 7.42. Arterial partial pressure of carbon dioxide 40. Bicarbonate 25. D. pH 7.47. Arterial partial pressure of carbon dioxide 48. Bicarbonate 34. E. pH 7.6. Arterial partial pressure of carbon dioxide 24. Bicarbonate 23. The case scenario is: a 34-year-old woman is brought to the emergency department by ambulance due to nausea, dizziness, and confusion. Her boyfriend arrives with her and says that he found her lying on the bed next to an empty bottle of aspirin tablets. When asked about the potential ingestion, the patient admits to swallowing a bunch of aspirin pills a little more than 12 hours ago, after coming home from work. She also describes hearing an annoying buzzing sound that won't stop. Temperature is 38.3 and pulse rate is 102 per minute. She appears agitated and confused. The question is: which of the following sets of laboratory results is most likely to be found in this patient? Your options are: A. pH 7.26. Arterial partial pressure of carbon dioxide 60. Bicarbonate 26. B. pH 7.37. Arterial partial pressure of carbon dioxide 18. Bicarbonate 10. C. pH 7.42. Arterial partial pressure of carbon dioxide 40. Bicarbonate 25. D. pH 7.7. Arterial partial pressure of carbon dioxide 48. Bicarbonate 34. E. pH 7.6. Arterial partial pressure of carbon dioxide 24. Bicarbonate 23. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is pH 7.37. Arterial partial pressure of carbon dioxide 18. Bicarbonate 10. This question is designed with the focus to assess your ability to conduct laboratory or diagnostic studies. Acute salicylate intoxication typically presents with nausea, vomiting, dizziness, confusion, tinnitus, fever, and tachypnea within several hours after ingestion. Two different acid-base abnormalities are characteristic. Primary respiratory alkalosis occurs because salicylates directly stimulate the medullary respiratory center, resulting in increased ventilation and loss of carbon dioxide in the expired air. Primary anion gap metabolic acidosis develops because toxic salicylate levels increase lipolysis, uncouple oxidative phosphorylation, and inhibit the citric acid cycle. This results in the accumulation of unmeasured organic acids in the blood, example ketoacids, lactate, increasing the anion gap. Therefore, salicylate toxicity classically presents with a mixed acid-base disturbance, with arterial blood gas sometimes showing a pH within the normal range, as the two primary disturbances shift the pH in opposite directions. There is low serum bicarbonate due to primary metabolic acidosis and low arterial partial pressure of carbon dioxide due to both respiratory compensation for the metabolic acidosis and the primary respiratory alkalosis. Because of the mixed disturbance, the arterial partial pressure of carbon dioxide is lower than expected for respiratory compensation alone. That is, per Winter's formula, the expected arterial partial pressure of carbon dioxide due to respiratory compensation is 23 mmHg, but the mixed disturbance, the arterial partial pressure of carbon dioxide is lower than expected for respiratory compensation alone. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. A. pH 7.26. Arterial partial pressure of carbon dioxide 60. Bicarbonate 26. Low pH with elevated arterial partial pressure of carbon dioxide is consistent with primary respiratory acidosis, which can occur with the respiratory depression seen with opioid overdose. Bicarbonate is slightly elevated, which is consistent with the small degree of metabolic compensation that occurs in the acute setting. Full metabolic compensation requires approximately 72 hours. C. pH 7.42. Arterial partial pressure of carbon dioxide 40. Bicarbonate 25. These values are consistent with normal acid-base status. D. pH 7.47. Arterial partial pressure of carbon dioxide 48. Bicarbonate 34. High pH with elevated bicarbonate represents primary metabolic alkalosis, which can occur with intractable vomiting. Arterial partial pressure of carbon dioxide is elevated and consistent with appropriate respiratory compensation. E. 7.6. Arterial partial pressure of carbon dioxide 24. Bicarbonate 23. High pH with low arterial partial pressure of carbon dioxide and near normal bicarbonate represent primary respiratory alkalosis with minimal metabolic compensation. This can occur with any cause of acute hyperventilation, like panic attack. Your take-home message from this question is that salicylate intoxication should be suspected in patients with the triad of fever, tinnitus, and tachypnea. Salicylates both stimulate central respiratory drive to cause primary respiratory alkalosis and disrupt cellular metabolism to cause primary anion gap metabolic acidosis. Therefore, toxicity classically presents with a mixed acid-base disturbance and a blood pH sometimes within the normal range. Nailed the answer? Great! Click above to level up. Still learning? Rewatch and get it right next time. Understanding is your key to success. Unlock your USMLE and medical exam dominance with our awesome resources. Share the knowledge, hit that like button, and subscribe for medical exam mastery. Your future doctor self will thank you.